Hello, my name is Carol Goodyear. I'm the Program Director for Nursing Research here at St. Luke's Health System. Today, we're going to really go through and do an appraisal of a level 1 research study using the Johns Hopkins evidence-based practice appraisal tool, specifically Appendix E and Section A. So for this short video, you will need Appendix D, Appendix E, and the research publication, The Effect of Bergamot Essential Oil Aromatherapy on Improving Depressive Mood and Sleep Quality in Postpartum Women, a randomized controlled trial. We are going to be using the Johns Hopkins evidence-based practice model and specifically their appraisal tools. But first, we want to just cover a little bit about research. Research, as I think that you know already, is that systematic investigation when there's not enough evidence out there or not enough evidence available for us to review. Quantitative research is all about discovering facts, and it's data collection with measuring things, analyzing that data with statistics. You have an independent variable, which is the intervention, and you have a dependent variable, which is the outcome you wish to see from that intervention. So an example of that would be the impact of music therapy with post-operative heart patients on pain control. Qualitative research is different than qualitative. It's really about understanding human behavior or experiences through observation or interviews. Themes are gathered from the participant words or from their observed actions. Data, in this case, is their participant words and captured by the researchers, and they go on and interpret those words. They pull together and they gather the themes from those words and make some sense out of it. An example of this would be a high schooler's experience of community in a lower social economic neighborhood. In the Johns Hopkins evidence-based practice model, there are 5 levels of evidence. Levels 1, 2, and 3 are the research levels. 4 and 5 are not research, but they're literature reviews, integrative reviews, case reports, quality improvement, clinical practice guidelines, things like that. If you find one of these, you're going to use the Appendix F to appraise them. But because we will be going over a randomized controlled trial, that's a level 1 research study, and we will be using the Appendix E. So Appendix E is used for levels 1 through 3, which is quantitative. Qualitative includes studies that pull together multiple research studies and make some sense out of them. One of those is called a systematic review. Also, there's a thing called synthesis reviews as well. Or mixed method studies is also included in these levels 1 through 3. It's really, really important as you go through the levels and look at the levels to have your research definitions cheat sheet that I have given you. And it's 2 pages. This just shows the first page. So let's get going with looking at this publication. So I want to say the first thing is that I always read the abstract, because the abstract gives you most of everything that you need to understand this specific research and to understand the outcomes. So when I read the abstract, then I get my questions. I'm going, well, what exactly does that mean? And so maybe I have a question about results. So I'll immediately go to the results and read that just to answer my own questions. You don't have to do it this way, but I highly suggest you reading the abstract first because it does give you a good sense of what this article is all about. The other thing that I do immediately is look at the introduction and go immediately to the last paragraph, specifically the last sentence. Generally, that last sentence is going to give you the purpose of the study, which also puts your mind in a frame of what the study is about, so then you can have a good frame of when you really start reading the article. So in this case, that's on page 2, and it's a sentence that is above the methods section in that last paragraph of the introduction. This study was designed to investigate the effects of bergamot essential oil on depressive mood and sleep quality in postpartum women. So now we know exactly what it's like. Now, that's also in the title too, so you probably get a good idea, even by the title, about this publication and about this research. The introduction then gives you what is known and not known about the problem. The researchers should really identify why this study really matters, what kind of gap it's going to close by doing this study. And then you also want to assess the currency of the literature. Is it within the last 5 years, or is there some seminal publication or seminal study that they note in that introduction? So if you look at Appendix E, Section A, on the yes/no questions, we've already talked about the top 4 of those questions. Does the research identify what's known and not known? You get that from the introduction. The second question is the same. It's about gaps in knowledge. It's about the purpose of the study. All those kinds of things are in that introduction section. The next piece is the methods. In this case, because it is a randomized control trial, you do want to assess how the researchers actually randomize the groups. And in this case, it is in the methods section on page 2. It's in the second column. And near the top, in the top paragraph there, the researchers assign the participants into 2 groups randomly by flipping a coin, with heads assigned to the experimental group and tails assigned to the control group. So it tells you right there exactly what they did. Flipping a coin is one of the best ways of doing it. There's 50-50 chance every time you flip a coin. You want to also look at the inclusion and exclusion criteria in the methods section. Does it fit with what you already know, specifically the background knowledge, which is in the introduction? You assess the sample size. Did they do some kind of analysis to make sure their sample size was efficient? And this is what's called a power analysis. So you always want to look for those statements somewhere. Look for some kind of statement about how they came up with their sample size and if they used power. In this case, again, in the methods section in that second column on page 2, that third paragraph down, the sample size was estimated using G-Power. And G-Power is a software program that helps you come up with a power analysis. That's really all you really need to know, that was done. This is a really key piece to good research is that they've done a power analysis. Don't get too bogged down in the stats itself. You can kind of skip over some of those pieces. So another important piece in the methodology, and sometimes you have to look for it, sometimes it's hidden somewhere, but it's around data collection. And the researchers should give you enough information that you could take this data collection methodology that they've done and repeat it in another study. So was it described very well? That you can repeat the study, right? And then if assessments were used, did they note the reliability and validity of those assessments? All of those things were done. That was started on page 3. They do talk about the sleep quality scale and also the other scale that they used. They talk specifically about reliability a lot in here. They do mention validity as well of these 2 assessment tools. But one area that you always want to note is, did they do a Chromebox alpha? Did they report a Chromebox alpha? And that is really just a measure of how reliable a tool is. And obviously they did in here. You can see it very clearly that they talk about Chromebox alpha under the data collection section on page 3. So again, all of those things that we just talked about are in your yes nos on your Appendix E, Section A, when you're doing your appraisal and your appraisal worksheet. All of these questions that we just talked about are already there. You click a yes if it's there and no if it's not. Obviously, in this case, everything was there, so it's all a yes. One of the things that is not actually noted in this study, but can be noted in other studies, and that is if you send out a survey to a group of people, you want to get at least 25% of those people to respond back. And that's something to note in any kind of survey research. You have to have a pretty good percentage who fills out your survey, or else, you kind of question if you're really truly getting a good representation of your sample and how they feel. Okay, results. You always look for a table in research studies that show you the two groups, the experimental group and the control group. Do they have similar characteristics? And you want them to have similar characteristics. You want them to absolutely be the same at all possible. And on page 5, in this case, table 1 is the comparison of participant characteristics, and they're very similar. You want to look for sentences in the results section that really kind of summarize what the stats are all about, right? So they do this fairly well in the results section on page 4 in the second column. In that first paragraph, it states the results support positive effect of 2 weeks of bergamot essential oil aromatherapy on depressive mood in postpartum women. So it worked for depression. The next paragraph down, it states sleep quality was not significantly different between the two groups. So it did not work on their sleep quality. So it worked on depression, but not on sleep quality. So that's good to note that in the results section, you just look for those key sentences to pull out the bottom line. They should also have those key sentences in the discussion session as well. And it should match pretty well with what they're talking about in their results section, right? Does it match up? Are they going off and saying something different? Generally, that's not the case. Most researchers, and good ones, have a conclusion to everything. And part of that conclusion are the limitations to their research. And here you want to think through, well, what other limitations could there be? Did they miss some limitations that you thought maybe were really important? And so that's it. That's it for doing the randomized control trial level 1 evidence using the Appendix E, Section A. Hopefully you were able to follow along fairly well and able to make sure that you understood exactly what was going on.